I did this at the medical school, and someone came up with the idea that I should do this again here at our Coral Gables campus, though I see some medical school people here as well. Let me talk about healthcare reform for about 30 minutes. I'll tell you what the impact is going to be on our own healthcare plans here at the university, trying to anticipate some of your questions, and I'd be happy to answer your questions. It's not as popular as many people thought it was going to be with the American public. People are very concerned about the fact that it's going to be mandatory now for everybody to take health insurance. Some people think that's a violation of our fundamental right not to have health insurance. If we were going to do that, we could eliminate the fundamental right not to take care of someone in an emergency. Because the fact is, and I want to start with this as my fundamental argument, unless we all have health insurance, those of us that do have health insurance, particularly those of you that work for the University of Miami and have relatively good health insurance, are paying for all the others. Into our health care bill, we are absorbing everybody that walks into our clinics or our hospital or sees one of our doctors who doesn't have health insurance. And that's the argument that both the president made and those who have advocated universal health care have continually made, that if we let some people off the hook because they're young and healthy, then we end up paying if something happens to them. And much of the high costs of hospitals that, as Michelle Chulik, who runs our hospitals, will tell you, is absorbing the costs of people that aren't insured or people that are underinsured, which is just as much a problem from my point of view. We keep forgetting people that have lousy health insurance are also shifting onto us. All of this is called cost shifting. Now, in this country, we've known this for a very long time. And as a matter of fact, Franklin Roosevelt, when he did Social Security, tried desperately to introduce Medicare at the same time, that is, to take care of senior citizens, because they were clearly the most at risk. He just couldn't put together the politics. He was far more liberal than his cabinet. In his cabinet, listening for the first time to very strong voices from the American Medical Society who were arguing socialized medicine, that was the first time that concept was introduced, strongly objected because they didn't believe they could put the politics together to do both Social Security as well as Medicare. And Franklin Roosevelt regretted it his whole life. And when he died, Harry Truman, who was his vice president at the time, who became president, tried again to try to get health insurance for senior citizens. Those were the first big movements for the expansion of the government role in health care. And Harry Truman couldn't do it. Again, he couldn't put together the politics because of strong opposition from the American Medical Association. The doctors were very powerful in arguing that this would put government regulation into health care, and they argued that they were, in fact, taking care of most people by discounted rates and other kinds of things. And it was left to Lyndon Johnson, who could put the politics together, mostly because he broke people's arms. Someone said to me the other day, don't you really object to a health care bill that was so messy with people screaming at each other? I said the opposite. I said it would have been much easier if we allowed these smoky back rooms, because that's exactly how Lyndon Johnson got it done. Lyndon Johnson didn't know what the word transparency meant. He didn't have public hearings. He didn't have members of Congress calling up experts, asking their views. He simply knocked some heads, put them all in the room, cut the deal, got Wilbur Mills' argument that we should also have Medicaid at the same time for low-income people. And so the explanation for why the process was so messy is because we have never done very large steps in terms of social policy or health policy out in the open. This time we did it out in the open. And that accounts for a lot of the messiness that took place. And Johnson was able to do it. In the process, we also covered low-income people, and the reason we did that because Wilbur Mills from Arkansas, he was the guy that was found in the pond with Fanny Fox. Fanny Fox. I'll explain to the young people here about that episode in American history. Wilbur Mills was very smart, and so were the Southern Democrats at the time, who are now, of course, Republicans. They wanted to shift funds. They wanted to put money into the southern states, and they knew that Medicare wouldn't necessarily put a lot of money into the southern states because the southern states had a younger population. So Medicaid has become the major employer in the South. That investment in low-income people, in the health care of low-income people, is a major employer, and Wilbur Mills was smart enough to link that with what Lyndon Johnson wanted, and that was health care for the elderly. And in fact, Lyndon Johnson was very sensitive to history, and when he got the bill to sign, he actually went to Independence, Missouri, to honor Harry and Bess Truman, and signed the Medicare bill, and the Medicaid bill, as a matter of fact, in Independence, Missouri. And he gave the first Medicare card to Harry, first cards to Harry and to Bess Truman. As Johnson was walking out, a young reporter from the New York Times came running up to him and said, President Johnson, I'd like to thank you on behalf of my mother. And Johnson turned to him and said, you should thank me on behalf of yourself. For years, people believed that what he was saying was, hey, someday you're going to be on Medicare. But he actually wasn't saying that at all. And thus comes the politics of health care reform. He was saying something quite different. He was saying if you had to pay for health care for your mother, your lifestyle would change. And in fact, without Social Security and Medicare, if all of us had to take care of our elderly relatives, both in terms of paying for health care or writing a similar check for Social Security, no one in this country would be able to send their kids to college, to buy a house, or to have a second car. In fact, one way of thinking about these programs is that they're middle-class subsidies for middle-aged people because they have totally changed lifestyles in the United States. The reason they're the third rail in American politics, the reason they're so powerful as programs is because they are, in fact, subsidies for middle-aged, middle-class Americans. Not simply because the elderly all vote and they're very powerful, but because those investments, and Johnson finally figured out the politics, and the way in which he did that, he kind of tricked the AMA into supporting it because we were in the middle of the Vietnam War. And he called in the AMA supposedly to support the men in uniform, and as part of the conversation in front of the press, he kind of tricked them into supporting it. But Johnson understood all of this. He understood that this was going to be an absolutely critical investment. And in fact, those programs have had slower growth rates and have slower administrative costs, about 2%, than any of the private sector programs. Whatever people are saying about government programs being expanded, if they're being expanded, it's because the populations are growing, not simply because their administrative costs are growing. It's really their populations, and their costs have grown much more slowly, in large part because they're heavily regulated programs. They really determine what they're going to pay for each service, but they fundamentally changed what it means to be a senior in America. They have changed what it means to be a middle-class American, because no longer are we totally responsible, though many of us continue to subsidize our elderly relatives, no longer are we totally responsible for their health care or for a payment called Social Security, which basically has lifted most seniors out of poverty. So these are powerful programs. They now, if you throw in veterans health care, the military, the Indian Health Service, they now constitute almost half of all health care spending in this country. And so the government, even though everybody complains about the government expanding its role, the government is the big player. And I want to start with that underpinning my discussion of what the President and the Congress was trying to do, because I think it's very important to understand that we started out with the government being a big player. And they became a big player because there was no private sector substitute for them. No one wanted to insure the elderly in this country because as you get older, you get sicker. So no one could make a lot of money if they were going to take the risk on senior citizens or on poor people. And so that becomes a natural government role. We have been able to take giant steps in terms of social policy where we have been able to make a clear argument. An argument about the problem and an argument about the solution, and we've been able to build consensus about that. And so the expansion of government into healthcare has primarily been where the private sector was not prepared to take on the responsibility. High-risk veterans, people who are handicapped, poor people, seniors, people that are older that are getting sicker, people with chronic diseases. There it's been a natural role for the government. And here comes a whole generation of presidents after Lyndon Johnson who also believed that we had to find a way to cover everybody else, particularly those that aren't insured. How many people here have a friend or a relative who doesn't have insurance? Almost lots of people do. How many people have a friend or relative that doesn't have insurance or has lousy insurance? You know, there are just a lot of people in our society. And that's essentially what Clinton's debate was about and what the new debate was about, which ended in what we hope is a successful bill. This discussion, most recent discussion about health care reform, and I won't go through the whole Clinton period and what we tried to do. I still have the marks on my back, and it's, you know, I still have some bruises over that debate. This debate was in a different context. Obviously, we have an economic downturn. Larger and larger numbers of people were losing their health insurance. Everybody was getting their health insurance squeezed. And yet, it was not a debate about the financing of health care. Obviously, there was a finance dimension because we were expanding health care. It didn't do a lot, and we didn't really have a fundamental debate about how we're going to control health care costs other than by covering more people. It was really a debate about coverage. This debate that I started to talk to you about, and that is, if you're not covered, I have to absorb your health care costs in my insurance. That institutions like the University of Miami, the largest employer, and government institutions in our community are the only ones, the public sector, the University of Miami. We don't have large corporations with big health care costs here. So there aren't a lot of people in town that have very good health insurance. Now, not only do we cost shift around, but spouses and family members move on to that health insurance, whatever the better plan is, or the least expensive plan that provides the most comprehensive coverage. So this debate was really about coverage, about getting everybody covered one way or another. But it also was a debate that reflected the politics, and that is the politics were that you get killed if you talk about the expansion of government. Even though within the plan there's a big expansion of government's role. The plan, basically the president ran around and all the candidates ran around and said, if you've got good health insurance, you can keep it. We're not going to change it. If you don't have health insurance, we're going to give you some options, mostly private sector options, with some exceptions. That is, if you were poor working class, we're going to expand Medicaid to individuals where it doesn't now cover. And to low-income families, you're going to go through the Medicaid system because most of your kids currently are covered by the Children's Health Insurance Program or the Medicaid program, so we're going to put you through that program. Big slot in this bill. But the rest of you are going to have some private sector choices. Those choices are going to be administered by the states, and you're going to be able to go in, and if you're low income, you may get some subsidies for those private sector choices. And the states, working with the federal government, are going to give you some different kinds of health plans that you can choose from. But the fundamental point is all of you are going to have health insurance. You're not going to get off the hook. We've got to have everybody with health insurance with a big investment in primary care.